Hello, 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 and welcome to my podcast, Life's Easy with E. And I am EzE. I'm actually recording this live on the JOB. As you can see, I'm in my work uniform. I'm actually up on the third floor in a building here where I work. If I sound a little funny, it's because it's already been a long day. I've already worked half a shift anyway. I'm taking a little break. I had intended to record this and have it live this morning, but due to circumstances beyond my control, I'm just not getting to it. What I'm attempting to do now is just, put out a little something for my people. So allow me to reintroduce myself. My name is EzE, and I am a chronic kidney disease patient, just like the people that I'm attempting to reach. So I'll go ahead and get started. Give you a little bit of what's going on with me today. Just came from dialysis. Always try to show the bandages. Well, I didn't just come from dialysis. I left dialysis around 10:30 this morning. But yeah, I had dialysis today, and now I'm on the job, taking a little break. I'll clock back in about 30 minutes, and I'll work for about another 3.5 hours. Then I'll go home and crash. Uh, so far, so good as far as the dialysis. Although I'm a little frustrated somewhat with myself, but mostly with my clinic because when you go to dialysis, they try to pull off the amount of fluid that you take in. So, for instance, it's counted in kilos. So, if I put on 3 kilos, I want to try to take off 3 kilos, maybe a little more, so I can go the next 2 days before I have to go, before I have to go back to dialysis. Well, for the last two weeks, I've only been taking off. If I put it on 3, I may take off like 2.6, 2.7. So my weight's starting to creep up a little bit because they're not taking off the right amount. And the reason being, and actually the reason for this podcast is because I suffer from a condition called hypotension. 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 The definition is blood pressure that's consistently 90 over 60 or below. And to give you an example, when I got up this morning to go to dialysis and check my blood pressure was 86 over 55. So that would lead me to be classified as hypotensive. So everybody in the world knows what hypertension is. That's blood pressure in excess of 130 over 80. And of course, normal blood pressure being 130 over 80. Again, my blood pressure is consistently low. And when your blood pressure gets low on dialysis, they take a couple of measures to try to help you with that. So, in fact, I'm gonna go ahead and get started in the podcast. Uh, and the reason why I decided to do this podcast, in addition to my own issues, is I decided to ask a tech, what was the number two issue that they tend to deal with in dialysis? And she said it. I mean, not missing a beat, not thinking about it. Low blood pressure. That should have been obvious to me because I actually have low blood pressure and suffer from it every day of my life. Uh, but a lot of people with chronic kidney disease suffer from low blood pressure. This show's executive producer, Shatera, she's a dialysis patient. She suffers from she suffers from chronic kidney disease, and she too has bouts of low blood pressure. So, in fact, research suggests that 20 to 30% of CKD patients, dialysis patients, suffer from it. Honestly, I thought it would have been higher because everybody that I know on dialysis has the issue with low blood pressure. So again, my blood pressure this morning was 86 over 55. So that's definitely low blood pressure. Now that said, I deal with it to the best of my ability. So what I do is is well, I'll talk about some of the things that can be done for low blood pressure in the next couple of minutes. But so now that we've established that a common issue in dialysis is low blood pressure, what causes it? And so I'm going to go ahead and, start to talk about that. Low blood pressure in chronic kidney disease with patients comes from a couple of, well, it's caused by a couple of reasons. One term that's known in the medical profession, one that I just learned, is called intradialytic hypotension. What that means literally is dialysis brings on low blood pressure, or the low blood pressure condition is caused by the dialysis. And what causes the low blood pressure condition is that the body is unable to handle the fluid loss during dialysis. So when this happens, the patient's going to get dizzy. Of course, the blood pressure drops. Uh, your thinking becomes fuzzy or muddled. You may get cold sweats. You may feel nauseous. Some people vomit. Cramping usually occurs. These are just some of the symptoms that happen with with low blood pressure brought on by dialysis. Another Another issue that could bring on the low blood pressure is taking on too much fluid and trying to take off said fluid. So you have to definitely be mindful of your fluid restriction. Uh, because if you take on too much fluid and then you try to take it off, it'll cause your blood pressure to drop. Again, that'll be the side effect of the body not being able to handle the fluid loss. You got to think to yourself, from Monday to Wednesday and from Wednesday to Friday is 44 hours in between your treatments. They're trying to take off 44 hours worth of fluid retention in 4 hours. So that is going to shock your system no matter how you look at it. So that's something you got to keep in mind. So if you have a fluid restriction, it's very important to try to adhere to it. And that's one of the things that unfortunately here during the summer it's very hard to adhere to. My last podcast hit on the things that we try to do to keep ourselves in an optimum fluid balance. If you want to check out my previous podcast, and some of my other podcasts hit on that too. Another issue that sometimes causes low blood, that causes low fluid levels, or rather low blood pressure, is a condition called hyponatremia, which means low blood sodium. Sodium helps to regulate the fluid levels in the body, the fluid levels in the blood. And of course, chronic kidney disease patients unfortunately have a difficult time regulating their electrolytes. So if you have too much sodium in your system, you're going to end up retaining water. But if you have too little sodium in your blood, then you'll actually end up losing water. And then, of course, the low blood pressure condition can occur in addition to in addition to damage to organs, especially your brain, because the first thing is you start to, have problems thinking, hallucinating, things of that nature. So those are the two common issues that people like myself tend to suffer from or have. Again, intradialytic hypotension and hyponatremia. Another issue that affects quite a few of us is heart failure. Now, heart failure in and of itself doesn't cause low blood pressure. It's usually brought on by high blood pressure. But what happens is heart failure can damage your kidneys. Then, of course, if your kidneys become damaged and you start to go through the stages of chronic kidney disease, then you'll start to suffer from low blood pressure due to the fluid loss during dialysis or the low blood sodium. So these are things that we have to look out for when we're in chronic kidney disease and when we're on dialysis. Now, unfortunately, my research and my own personal life experiences, there's not really a whole lot you can do if you're suffering from low blood pressure. During dialysis, if your blood pressure drops, what a tech or a nurse will attempt to do is elevate your feet. Quite honestly, most of the time your feet are elevated anyway during dialysis to help stabilize your blood pressure to keep you from dropping. But if it becomes if it becomes extreme, then what may happen is they may try to elevate your feet to the point where your head is above, where your feet are above your head. So they might recline you back to an extreme angle to get your head below your feet, and that may help lessen the shock of the low blood pressure. Another thing that might happen during dialysis is they may administer a saline solution, up to 100 cc's at a time to try to, to level you out, to stable you. The saline works in two ways. The water content of the saline solution helps to, add volume to your blood, which is going to help raise your blood pressure. And then the salt content in the saline is going to cause your blood vessels to constrict, which again will help to raise your blood pressure. And they'll give you as much saline as necessary to a point. Now, they can't just go and load you with the fluid, because then you're going to cause another problem called fluid overload. But they'll give you what's safe and what's recommended. Those are just some of the things that can happen in dialysis. Another thing that may happen in dialysis is you may get medication. A medication that's commonly given is called midodrine. Those of you on dialysis, you probably heard this. It's given sometimes during treatment, before, during, sometimes after. And this medication is also prescribed outside of the clinic. I take midodrine myself 3 times a day, every day, because again, I'm hypotensive. So I have low blood pressure, whether I'm on dialysis or not. Um, Another medicine that's prescribed is called fluticasone, and I take this nightly to also help with my blood pressure. So there are several things that can be done, to help with the low blood pressure condition. My research also indicates that caffeine can help raise your blood pressure, albeit temporarily. And another stimulant that has been known to raise blood pressure is called ephedrine. Now, before I go so far as to say if your blood pressure is low, take caffeine, take ephedrine, understand that these two particular stimulants are just that they make your heart beat faster. So they may raise your blood pressure, but if you're already having heart problems, this may not be healthy for you, especially the ephedrine. So I would I would go so far as to say, if you decide that you want to try to stimulate your blood pressure by taking these, before I do so, I would actually get with with a physician and just ask the question, especially if you have heart problems. So as I was saying, medication can help, positioning can help. One thing that I left out from earlier is if the problem with the low blood pressure persists and starts to become dangerous, they may lessen the amount that that they'll take off during your treatment, or just might outright stop your treatment. Period. Because again, unfortunately, low blood pressure can be more dangerous and more deadly than high blood pressure. So you have to, they have to make the medical personnel will take the appropriate steps to protect, the patient. As I was saying earlier, there are a couple of things that can cause the low blood pressure condition. One of the things that I didn't mention earlier is heat. Heat can cause low blood pressure issues because if you get too hot, and I'm specifically saying like being outside or being in a hot environment, the body's attempt to cool itself down will cause the blood vessels to open up. And what that'll do, that's the body's defense mechanism in trying to get rid of excess heat. The problem with that is it also drives your blood pressure lower. So if your blood pressure is already low, and let's say you're standing outside in 95-degree weather, the sun, you're going to find that your blood pressure is going to bottom out, and you're going to end up probably getting sick, perhaps passing out. So again, there are several things that can cause low blood pressure. Dialysis can cause it. Uh, a low blood sodium condition can cause it. Extreme heat can cause it. These are things. Heart failure, can lead to it. So, we have to be mindful of other things that could cause low blood pressure. And low blood pressure can be very dangerous. Chronic kidney disease patients tend to have a higher than average mortality rate to begin with. And one of the issues that brings on the mortality is the low blood pressure, because sometimes, again, up to and including passing out, and you may not be able to recover. And when your blood pressure is really low, your heart's probably beating, faster than normal, which could bring on a heart attack. So low blood pressure is a very, very serious, although not common in the general population, but common with people with chronic kidney disease. The entire world knows about hypertension, especially if you're in a particular race. You know everything to know and more about hypertension. But hypotension isn't as well known, but again, is a very dangerous condition. And of course, I wanted to make sure that those of you with chronic kidney disease realize how dangerous this could be. If you're being prescribed medicine for it, please take it. If you suffer from it qu- quite often, again, the research suggests that 20 to 30% of kidney disease patients tend to have it. Again, I would have thought it was more, because everybody on dialysis that I know has had an issue or more, an occurrence or more than occurrence, with low blood pressure. I had one during dialysis. In fact, before I left the house, my blood pressure was low. So, I'm fairly familiar with it. Like I was saying earlier, they were saying that you can, caffeine may help. Again, I'm hesitant to even recommend. I can't recommend that. I would say check with your doctor. If you are having low blood pressure issues and somebody walks up to you and say, well, maybe you need some water, be mindful of your fluid restriction, okay? Be careful of that, because you might go from a low blood pressure situation to being overloaded with fluid. So that was what I wanted to come and talk to you guys about today. Uh, Hypotension and its effects, the dangers of hypotension. I wanted to talk about what can cause it, the body not being able to handle fluid loss during dialysis, having too little sodium in your blood, having a heart issue such as heart failure. Those are just some of the things that can contribute to a low blood pressure condition. It can be treated by lessening the amount of fluid that you take in, which means you don't have to have such an intense dialysis treatment. You can take medicine such as midodrine or fluorocortisone. You can perhaps use stimulants. All these, and there are probably more things out there that can help with your low blood pressure condition. This is just the tip of the iceberg. And again, I battle with this every day. And so, medication and trying to adhere to my fluid restriction is what I do to try to combat it. So that's going to be my time for today here. If you like the video, if like what I'm doing here, like the video on Facebook, subscribe on YouTube. I do some stuff on TikTok. I was going to talk about my workout that I had, but I'm going to probably do a video over the weekend. So check me out on TikTok. Again, my name is EzE. I am a chronic kidney disease patient. And in closing, I want to say take care of yourselves, remain healthy, stay hydrated to the best of your ability, and I'll see you soon.